so glad and pleased that you all are with us. We're here with John Turton from Southwest Hospital in South San Antonio, which is right down the road from Palo Alto College. So thankful that you're here with us today, and would like to understand and know a little bit more about what Southwest Hospital is doing within our community as we've been running into this challenge, of course, of the pandemic and COVID-19. And so, John, what are some of the things that Southwest Hospital is doing?
Well, I'm really pleased to be here and represent my colleagues and the 850 employees and their families that actually call Southwest General home and make our community of South San Antonio home. And, you know, as we look at how we care for our community, nowhere does it become more important to how we care for our community than to how we do so during this pandemic. And we know we've received a lot of support from the community. We've talked about healthcare heroes. We've talked about those people that have, you know, put on their personal protective equipment to care for our sickest patients that we have in the city as we battle this enemy that we can't see, we can't touch, we can't feel, this virus. And our hospitals, all hospitals in San Antonio, not just Southwest General, but all hospitals in San Antonio, need to be safe and ready so that we can care for our ill and care for those that are sick or injured. And they know that when they come to the hospital, that we're going to take great care of them. And that's an evolution process that we need to do to how we do that and how we communicate that with how we work with our EMS responders, how we manage our patients at the entryways, how we work with our doctors, how we help screen our employees, and how we make sure that all of our employees get to go home safely to their communities and safe to go home. And it's taken a lot of work on a lot of people's parts to help make sure that we message that properly, we create safe environments, and that we also continue to earn and garner the support and trust from our local community. And that's part of what our job is at Southwest General, to be part of the South San Antonio community, is to make sure that they understand that they've got a hospital they can trust.
Well, you know, John, we had talked a little bit earlier, and we talked about hospital heroes, and I will tell you that your folks and you are hospital heroes, you are community heroes. COVID-19 is something that is unfortunately not going away anytime soon, and we all have to do our part so that we can all stay healthy and well and care for our families. What are some of the things that the Southside community can do, the Palo Alto College family can do that would help Southwest Hospital in this really transitional and dire time of COVID-19? What can we do to help?
Well, I think one of the things that we understand that we need to be part of as Southwest General is we need to be part of our community, okay? And so when we talk about being part of our community, we talk about being a responsible care provider. We start being a responsible neighbor to neighbors like our Palo Alto College, our South San High School, the retail that's going up and down Military, and making sure that people know they have access to safe healthcare, but then also know that we have to work together on these things. And our hospital has come out of challenging moments, challenging events, and this COVID crisis has actually reaffirmed our commitment to be a safe location for healthcare for South San Antonio. And so when we're talking about that, we need to help manage up each other about how we deal with that. While we manage our social distancing, while we manage our things, be able to talk about what are we doing in our South San Antonio community that's making South San Antonio a safe, great place to live. And we talk about that sometimes in what is often referred to as the social determinants of health: access to jobs, access to education, affordable housing, access to affordable healthcare. And we need to do our part as a healthcare provider to say, we're going to be with South San Antonio and do that. So as we work through this crisis, we appreciate the support we've had. The nurses and the techs and the therapists and the housekeepers and the plant workers and the lab technicians that have all made sure that we keep people healthy and we allow people to achieve their potential. And that's what we need to be about in South San Antonio. And that's why I'm really proud to be able to be part of the team to support Palo Alto College that also shares that commitment from an educational mission as we do so from a healthcare mission. And together we're going to make a difference for our community.
You know, John, you really said some key words, you know, community, collaborative efforts, you know, those are things that we all have to do, coming together to really make a difference, and coming together to really flatten that curve and keep COVID-19 going in the opposite direction. And education and sometimes it's repetition, you know, kind of, you know, hey, I'm putting on my mask today, I've got my gloves, I'm doing my hand washing and social distancing, and knowing that we're still in a pandemic. It has, you know, there hasn't been no declaration that it's gone away, and ways that we can really come together to make a difference is by continuing to go. And so can you tell us about maybe some you know, some strategies that, you know, that the community should do, is if they're going out and now that the city's opening up a little bit, what are some of the things that we can do to protect ourselves and protect our families?
Well, I think that we need to remind ourselves that this virus is not going away, okay? And that this virus might be minimizing itself, it might be, it's still an enemy that we can't touch or feel or see. So we don't know when we're getting exposed to it. So the way that we teach each other to help minimize the risk of not only us receiving it, but us being responsible for giving it to another family member or loved one who might be at further risk for that, is by making sure that we manage the opportunity for that virus to get on each other, ourselves. And we talk about that in terms of masking. Now, it's true that a mask doesn't stop the virus, it controls the airflow going in and out of our bodies. And when we control or break that airflow, we reduce the ability for that virus to travel, okay? It's true that social distancing helps us manage that. And so while we have to manage our social distancing, we also have to remind ourselves that the virus is still present around us, and that the distance between one person to another person might be the distance that that virus doesn't get to travel. And so we have to get comfortable in saying it's okay for us to wash our hands more frequently. It's okay for us to say, not shake hands. And I'll be honest, I'm a handshaker. And it's very hard for me to actually remind myself, not shake. I invite people to my office now a couple months into the crisis, and I ask them for their preferences. Would they prefer for me to be masked during our conversation or not? Because part of that is, what is your comfort level? What is your risk level? And we need to be cognizant that what I'm comfortable with might not be what you're comfortable with. And so we have to listen to each other and be perceptive to each other's needs. You could translate that all the way to some of the social injustice issues that we're dealing with nationally. Is, have we really listened to other person's concerns? And if you have a concern about infection risk, then I need to listen. If you have a concern about how I restrain you, then I need to listen. So I think there's a lot of commonalities between what we're going through as a country socially, as well as all the things that we're doing with on the healthcare side as well, about how we manage our exposure risk to each other.
Well, thank you, John. You know, key of listening and learning. We very much appreciate you joining us this afternoon, talking to us, taking time out of your busy schedule to talk to us, to help educate our community, help us connect with our community, and keep the Pláticas alive. And so we have this saying that Palo Alto College is the heart of the community, the corazón. And I will tell you that, John, Southwest Hospital is really part of that corazón, as we're keeping that heart pumping in the Southside community and keeping us all safe and well and healthy. So very much appreciate your time. Thank you so much for joining us this afternoon. Look forward to someday being able to get back to a firm handshake and getting to collaborate more on a personal level as things hopefully someday get us to a better place. Thank you.
Absolutely. We really appreciate the opportunity. We will be safe and ready for anybody if they need health care. And we want to thank you for the privilege of being part of your organization as well as being part of the South San Antonio community.
Fantastic. Thank you.